Our presentation is on Hydrocephalus by Richie, Andre, and Edgardo.
What is hydrocephalus? Hydrocephalus is a buildup of cerebrospinal fluid in the brain's ventricles, which results in pressure inside the brain. CSF is made constantly by the choroid plexus and inside of our ventricles. It travels down around the spinal cord and around the brain, acting as a cushion as a protection. CSF follows a cycle where it's produced by the choroid plexus, moved into the spinal cord and around the brain as a cushion, and it's absorbed back into the bloodstream. Due to blockages, there might be a buildup of the CSF in the ventricles. If too much is being made and too little is being absorbed, then the buildup in the ventricles causes pressure on the brain, which leads to an enlarged head. History of hydrocephalus. Hydrocephalus has been recognized since ancient times, beginning with the Hippocrates in the 5th century BC. By the 10th century, many pioneering physicians, such as Abulcasis, described early tools used to relieve pressure inside the brain. Over the following centuries, doctors tried to understand the condition, with some like Isbrand de Demirbraek believing it was caused by poor nutrition. Treatment ideas eventually shifted towards draining excess fluid from the brain. In 1744, Claude Nicolas Lecat performed the first documented ventricular puncture with tools he created. In the 1800s, it brought major progress to hydrocephalus treatments, including new drainage methods and the creation of the first shunts. In the early 1900s, Harvey Cushing advanced treatment further by identifying the source of the excess fluid and developing early shunt techniques. These historical developments led to today's effective treatments, such as modern shunts and endoscopic procedures. Etiology of hydrocephalus. Hydrocephalus can occur for numerous reasons. When you're born with hydrocephalus, it is called congenital hydrocephalus. Reasons for why babies are born with hydrocephalus can be sometimes unknown, be a correlation with a medical problem that might cause a blockage, or an association with birth defects such as spina bifida or aqueductal stenosis. On the right here is an image of a baby with spina bifida. The birth defect here is when a spinal cord doesn't fully develop, and then this can lead to issues with the production and absorption of CSF and causes the ventricles to build up and then creates a large head. After birth, children and adults can develop hydrocephalus, possibly due to head injury, brain tumors, brain bleed, or infection. And at these times, there are 3 types of hydrocephalus: compensated hydrocephalus, communicating hydrocephalus, and non-communicating hydrocephalus. Adults older than 60 might develop hydrocephalus, but at this time it is referred to as normal pressure hydrocephalus, NPH for short, as the enlarged ventricles have little to no effect on the pressure inside the brain.
Who are at risk of hydrocephalus? Basically, babies with birth defects that affect the spine or brain. When there is an infection in the uterus during pregnancy, such as rubella or syphilis, an infection can cause swelling in the brain tissues of an unborn baby, and then bleeding happens inside the ventricles. Could be due to complications of premature birth. Also, adults with tumors of the brain or spinal cord, also central nervous system infections such as bacterial meningitis or bumps, and also bleeding in the brain from a stroke or head injury, and lastly, other traumatic injury to the brain. Long-term outcome for patients and expectations: mobility issues and fatigue, cognitive issues and memory problems, impact of daily function activities. Children with hydrocephalus are more likely to develop disabilities. Patients treated in childhood need a long life follow-up appointments to make sure that they're okay. And if they receive the right treatment, they will live the normal life expectancy like regular human beings. And then some may experience vision issues and learning challenges and many more. treatments, medications, and other non-traditional treatments. There's basically two types of surgery options that can be used to treat hydrocephalus. Shunt method is basically when surgeons place a drainage method that keeps the fluid moving in your brain so it keeps it balanced and allows fluid to be more easily absorbed. People with hydrocephalus tend to have a shunt system for life. Endoscopic third ventriculostomy is basically when they use a camera to look into the brain, and surgeons create a small hole in the ventricle to allow brain fluid to release. And after these surgeries, you might need to go to therapy for whatever need is necessary. With children, these surgeries will be tough on them, but they might need outside help from other than like surgeries and like treatments and that. And then lastly, sources. Thank you for listening.